This is One-on-One. Dr. Adam Shiroff is the Chief of Trauma at Jersey Shore University Medical Center. Good to see you, Doctor.
Good to see you, Steve. Thanks.
Now, right next to you, if that camera pans over, get this shot, there is a fascinating skeleton next to you, right? And what are we looking at right there?
So this is a plastic model of the skeleton. You know, Steve, my patients do typically better than this.
Okay.
But this is a model just to demonstrate one of the sort of innovative procedures that we do at Jersey Shore, and it's a new technology used to fix rib fractures. And it's a problem that's been around obviously for a long time. And there's a new procedure out, rib fracture fixation, that's used.
It's called rib fracture fixation, because every time someone has had a problem with the rib, right, say they fracture a rib.
Correct.
My understanding is very often physicians will say, doctors say, look, rest, I don't know, the ice, then heat, then ice, then heat, rest, can't do much.
Right.
You say?
I say that's not the case anymore. You know, I'm not talking about the weekend warrior who cracks a rib playing touch football. I'm talking about the guy who gets hit by the car, falls 15 feet off a roof at a construction site, the traumatically injured patient. But there's now a technology, the titanium plating systems, that will allow us to put those ribs back together, treat them like orthopods have treated bones for years, prevent the pain that goes along with rib movement, prevent the respiratory compromise that goes along with that.
Oh, the respiratory compromise.
Right.
What does that mean?
So folks who have rib fractures, you and I walk around all day taking deep breaths, sighing, yawning, we don't even notice it. Folks who have rib fractures and chest pain, they don't do that, particularly with a number of rib fractures. So during that, the small air sacs in the lungs filled with fluid, they're not coughing, they're not taking deep breaths, they're at huge risk for pneumonia. And in the hospital with huge risk for pneumonia, those patients are going to end up on a ventilator, they're going to end up on the ICU, needing to go to rehab with a tracheostomy. You know, I saw this throughout my training for years and years, and there was just nothing you could do for these patients. Surgeons tried for 100 years to fix ribs with wires and different things, and now there's a technology that actually works.
What is the technology?
The technology is titanium plates, and it's very similar to what's been used in the past for treating broken jaws.
Where are the titanium plates?
So here, so you can see this blue,
Bob Morris, our director, you getting this? Yeah, I can see it.
blue plate there. There's a gold plate here. So there's this system that's used is by the DePuy Synthes Corporation, part of Johnson & Johnson. They make plates that are specifically designed based on CAT scan data for each rib individually.
Right.
So if you had to span, say, 2 fractures on a rib, you can use a very long contoured plate, and this would allow you to take care of a number of fractures with just one piece of hardware.
So hold on. How long do they stay in?
They stay in forever.
No.
Yes.
They stay in forever?
They stay in forever. I give you a little business card that you put in your pocket so the TSA guys at the airport don't go crazy. And
wait a minute, seriously?
Seriously. It's titanium. It doesn't cause a reaction. It's just like other orthopedic hardware. It's titanium.
So you give, in all seriousness, you give someone a card that says, look, I'm going through
Right. I have this kind of hardware. It's here on my chest. It's got screws with a head that look like this. It's very specific. So there's not a security concern. Because that's one of the first questions out of patients' mouths are, A, can I get an MRI? The answer is yes.
You can get an MRI.
It is. It's not magnetic. It's titanium.
Right.
And B, what's going to happen when I go through the thing at the airport when the TSA guys are freaking out that I've got a chest full of metal?
Who's eligible, who's not?
So eligibility, it's largely...
So let me put it this way. Sure. Who's a good candidate, who is not such a great candidate?
So a good candidate for this operation is someone who's got multiple rib fractures, has a decent sort of performance status, who's a decent baseline health. Although you could argue that those who aren't in baseline health have even more of a need to breathe the right way faster. So it's a patient who's suffering from pain, can't take deep breaths, their pain isn't controlled with just the normal sort of oral narcotics or Tylenol or Percocet or whatever, or those who have a chest wall deformity. So they can actually have multiple fractures that could cause an asymmetry in their chest, and that can lead to long-term problems down the road.
Age matter?
It does. I've operated on patients as young as in their 20s and as old as 90.
That's interesting. I'm going to shift gears here.
Sure.
The other thing I want to talk about is the trauma center that you're involved in. I hear trauma center, I think, oh, so you're talking about the ED or the emergency room.
Right.
Not the same thing?
Not the same thing. You know, when trauma center is a building, it's a hospital. And what a trauma center is it's a dedication by that hospital to the resources and the personnel to provide care for the injured patient immediately. So it's
Give me
that,
for instance.
So for instance, there's general surgeons all over the country that can take out a spleen, no problem. There's neurosurgeons at every other community hospital that can take out a blood clot from the brain. However, a trauma center has those specialists immediately available. And we've known since the 60s that getting the patient in the right place at the right time, in the right hands, is what saves lives. So trauma centers have that dedication to those resources.
What are we looking at right there in the video?
That's the state police helicopter North Star landing on the Jersey Shore.
Now, okay, so an ED.
An emergency room is incredibly valuable. Don't make no mistake. The emergency department at Jersey Shore, incredibly well run by Bob Sweeney, a good friend of mine. They see 85,000 patients a year. Trauma center, I may see only 2,000. But it's so resource heavy, and the emergency room will see such a breadth of everything from someone with a cold who doesn't want to go to their primary care doc to the woman delivering the baby who is coming in the door. So they have an incredible breadth, and really the trauma center and the trauma surgeon who's dedicated waiting for the patient, so the patient doesn't have to wait for that resource to come in.
Very different focus.
Very different focus.
One more thing. You're heavily into injury prevention.
Right, so
what can be prevented, what can't?
Right, so the vast majority of trauma, really even in the most violent areas of the country, the majority of trauma is what's called a blunt mechanism, which means, so there's penetrating trauma, which is stabs and gunshot wounds and things like that. And then there's blunt mechanism, which is car accidents, pedestrians and bicyclists being struck by cars, people falling off of things. And the majority of things are a blunt mechanism. So trauma, which is sort of an interesting in the business world, we like a lot of medicine, work very, very hard to put ourselves out of business. So a huge amount of energy goes into injury prevention. And a lot of trauma prevention is really reiterating what is common sense. So car seats. Is your car seat for your child buckled in right? We have a program that's every month in conjunction with the state police to ensure that it's free. Bring your car seat to Jersey Shore. They will check it, help you pick out the car seat.
You got to do it the right way.
Help you install the car seat.
I was actually concerned about this just the other day with our daughter. I said, I don't think this is
It's
right.
a little loose, right?
Yeah.
Yeah, I mean, it's
I really didn't know exactly how to do it, and I said, I can't take her. I just can't take her. You really have to know how to do it. Do you go to the police department?
It's done at the hospital. So there's people that are certified in these car seat things, and they will help check that. And another huge one is the focus on distracted and drinking and driving. There's a program that we run that touches between 8,000 and 10,000 high school age kids and their parents a year, and that's about put the phone down, don't drink and drive, be smart. Right? It's common sense. Don't text and drive.
Injury prevention.
Injury prevention.
Good stuff. Well, thank you very much.
Thank you very much.
That's fascinating, by the way.
Thanks.
Appreciate it.
Appreciate it.
One-on-one will continue right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Wells Fargo, PSE&G, the New Jersey Education Association, Health Republic Insurance of New Jersey, New Jersey Sharing Network, MD Advantage Insurance Company of New Jersey, and by the Russell Berry Foundation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.